All right, well, I think we will kick off because we have 42 participants, and what better number could we have to start a webinar with than 42? Welcome everybody on a rather grey November day. I'm sure, like many of you, we are looking towards Christmas and a bit of a break that may offer, and hoping that the COVID situation doesn't deteriorate as it is doing in large parts of Europe. Welcome everyone to this Oxfordshire Community Foundation webinar. Please mute yourself and keep yourself muted unless you are speaking or invited to speak. As I said, if you're able to change your display name to say who you are and the organisation you're representing, or introduce yourself in the chat box, then please do. The webinar is being recorded and will be made available via our YouTube channel, where all of our previous webinars, some edited highlights are made available. So do have a look there at some point. Use the chat box to ask questions, make discussion points, introduce yourself. And I'm going to kick off with a short introduction into the topic at hand, which is young people and the pandemic, with a particular focus on mental health and well-being. Okay, can I have the slides up?
Adrian, I'm afraid I've got a technical glitch with this slides. I've just asked Kate to project them for me, or you might want to do that yourself. I have them already. they're not here anymore.
I will probably just talk and see if the slides pop up, because there's not a huge amount to say. I mean, the first thing to say was that, just in terms of definitions about what we're talking about young people. Broadly speaking, that is adolescents. That's people in the time period from puberty through to adulthood, and that's, I mean, it varies from person to person, but it's usually about 12 to early 20s, maybe mid 20s, and that is, as you probably know, about the most common time period in people's lives for serious long-term mental health conditions to manifest or be diagnosed or come to the fore in some way or other. So it's a critical time of life in terms of mental health, and I think we know, and anecdotally have seen through the pandemic, and we'll be hearing later, as some of the impacts that there have been on younger people and their mental health. Now, I've got presence of you, so we've got something here. But so that's who young people are. Mental health, I think, is getting a much better understanding these days as a term. It is not just about mental illness, it is about broader mental well-being, and is akin to our physical health. Nobody gets up every day feeling 100% physically healthy, just as nobody gets up every day feeling 100% mentally healthy. And our feelings and experiences will fluctuate depending on our experiences in life. And that mental health can go up and can go down depending on what's going on in the world around us. But broadly speaking, the MIND definition, I think, is a pretty good one. It's about being able to function effectively and live a normal life. And it can be just as impactful as physical health. In fact, potentially more so. The biggest loss of days' work in 2019, 2020 was due to stress, anxiety, and depression. So mental health conditions are the biggest cause of loss of days at work. So they are. Mental health is critical, and it affects a significant percentage of the population every year. The MIND stat is 1 in 4. I would say all of us will experience periods of mental health during the year which are challenging to get through, and that's a normal part of life. So in Oxfordshire, young people's mental health, we've got a quote here from a grant application from a local organisation earlier on this year. We know there's been huge impacts on everybody through the pandemic in all sorts of different ways. But I think the fact that adolescence is such a sociable time of life, such a physically active time of life for so many people, means that some of those impacts have been felt very acutely by young people. And I think thinking about that is why we're here today, and I look forward to hearing more from some experts in a short moment. Oxfordshire Community Foundation, we obviously disperse a lot of funds to local organisations, and we were very proud to work with public health earlier on this year, helping them get money out into the local community sector to local organisations who are having the biggest impact on supporting mental health and well-being in Oxfordshire. And some of those organisations are listed here, and we're very pleased to offer that sort of service to help have impact locally with statutory partners and others. So on to today's speakers. We have 3 very interesting speakers I'm looking to hear from. We have Kat Arbuthnot from Public Health, Oxfordshire County Council, who has done a survey and a review of mental well-being that covers the whole age spectrum, but has kindly focused in on young people for today's webinar in her presentation. We'll then be hearing from Susie Besant, who's CEO of 180, a local organisation working to support young people who are at risk of detaching from education, often due to mental health issues and problems and well-being. Then we'll be hearing from Laura Hart, who has been supporting the change needed around young people's mental health by trying to create a whole new intervention, a new initiative to support young people in their mental health and well-being. And then, as ever, we will hopefully have time for some questions and answers and a bit of discussion at the end. So without further ado, it gives me a great pleasure to hand over to Kat from Public Health to tell us about the situation in Oxfordshire.
Thank you very much, Adrian, and bear with me while I just try and share my slides here. So I just want to check that you can see the presentation ahead of you.
I can see it clearly, thank you.
Perfect, thank you so much. So thank you very much for the introduction. As Adrian said, I'm Kat Arbuthnot. I'm a Specialist Registrar in Public Health, currently based with the team in Oxfordshire County Council. And today I'm going to try and set the scene of mental wellbeing across Oxfordshire using results from a mental wellbeing needs assessment, which I've recently undertaken. And just before going any further with this, I wanted to acknowledge the wide number of people who've had input and feedback on this work. So that includes partners within the Prevention Concordat for Better Mental Health, third sector and providers. So thank you. So today, in order to be able to set the scene, I wanted to do a few things. Firstly, I wanted to just go over the main aims and a brief overview of the project so that people can understand the data that we'll be looking at. And as Adrian said, although this was a project that looked over the whole life course, today I'm going to focus on the findings which particularly relate to teenagers and young adults and the impact of COVID-19. And at the end, I'm going to go over a very brief overview of recommendations which have come out of the report. So this project was a mental wellbeing needs assessment, and the aim was to give an overview across the life course of mental wellbeing and its wider community-based enablers and barriers across Oxfordshire. So here we've defined mental wellbeing as how people feel and how they function, both on a personal and societal level, and how they evaluate their lives as a whole. It means being able to make healthy choices and get the most from life. So really it's focused on this primary prevention end of the spectrum rather than mental illness, which Adrian also highlighted in the introduction. And so I think related to that specifically, it hasn't focused on like services for mental health or mental illness. When we talk about wider community-based enablers, I'm talking about those things within our communities which help us stay mentally well or can act as barriers to that. And I'll come on to that in more detail, but thinking about things like being active and access to nature and green spaces. And lastly, just before going any further, the report which I'm talking through today and an interactive summary of it will be made available soon through the Oxfordshire County Council web pages, and I'd be happy to circulate a link for onward forwarding when that becomes available. So we spoke about the context of the COVID-19 pandemic, and I'm very aware that everyone on this call is very aware of this, and perhaps this is stating the obvious, but I really wanted to highlight that this just hasn't been a health crisis, it's been a social and economic crisis. And what that means, it's really highlighted the fragile relationships which exist between our social fabric and our society, our economic and financial situations, and our mental health and well-being. And everyone's experienced the pandemic differently. It's been different for individuals, different communities, and it's highlighted inequalities, and experiences have come through many different pathways to mental well-being. And I'll talk about some of those during this presentation. Just before going on to mental wellbeing specifically, I also wanted to set a bit of context in the context of mental health in figures. So from a recent national survey in 2020, and indeed actually in 2021, 1 in 6 5 to 16-year-olds had a probable mental health disorder, and that's compared to 1 in 9 in 2017. So we're viewing this data with the background of rising probable mental health disorders. Locally, we know that we've had a substantial increase in the number of referrals to Oxford mental health services for children and young people between 2016-17 and 2019-20. And this really highlights the need for primary prevention and looking after our mental well-being as broadly as possible. So On to mental wellbeing specifically then. And firstly, I'm going to talk through some findings of a survey which has been carried out by Oxford University with partners, which the data from which we used in part of the needs assessment. And I'm firstly going to highlight some findings from the 2019 survey because that was for Oxfordshire, and I think they are still very relevant. So what that highlighted is that more students in year 12 compared to years 8 and 10 had low mental well-being. So that means that people's mental well-being decreased with increasing age through the teenage years. And that follows a similar pattern to data at national level, where well-being declines as children and young people get older, and it's consistent with the onset of many mental illnesses during adolescence. The survey also showed that feeling happy and confident about the future decreased with age, but the proportion of pupils who were being bullied was highest in younger years. The most common form of bullying was verbal, followed by feeling isolated or excluded. But in secondary school, 23%, or almost 1 in 5 cases of reported bullying, was cyberbullying, compared to 10% in primary school. So the Oxford 2020 and then very recently Oxford 2021 surveys asked about the impact of COVID-19 on young people. And the results that I'm highlighting here, again, these are from the survey which was undertaken by Oxford University with partners, are from all the areas which took place in the southeast. So not specifically Oxfordshire, but Oxfordshire was included in this. So for almost all wellbeing measures, older age groups reported more negative effects of lockdown.
Cat's been muted.
Can you hear me again now?
Sorry, Kat.
We can.
You know,
I can see myself in
apologies.
stereo there. It's slightly disturbing.
Where would you like me to? Shall I go back to the 2020 surveys? That's probably about right. Yeah.
Yeah, that'd be great.
Apologies. Am I sharing my screen appropriately?
Yeah, I think you just need to put it on full screen. Got presenter view
on full
again
screen
now.
on my computer. Is it on full screen on yours as well?
Presenter view again. Okay, do you know how to get from that to?
Yeah, you just need to do what you did before, Kat, and share your other screen, the one that you're plugged into.
Yep. Thank you. If this doesn't work, maybe you could share.
Yes, that's the one. Yeah, that's the one.
Yeah. Are you seeing the full screen now?
Yes, we can see it now.
Yeah.
Well done.
Fantastic. Apologies. There we go. So we were looking at the impacts. Is that okay? So looking at the impacts of COVID-19 and the results from the Oxford 2020 survey. And I think shortly then before I went on mute, I was saying that the survey showed that lockdown had more negative impacts on happiness and loneliness for older age groups, and that sleep was more negatively affected in older age groups. So across the survey, 40% of pupils in year 13 said they were often too worried to sleep. And the results of Oxfordshire were similar. They were 41% of pupils in year 13. In school years 8 to 13, those who are most likely to report deteriorations in their well-being were female, and those reporting from socioeconomic deprivation and use of food banks, and those with previous mental health support or upcoming examinations. So recently released the results in the Oxford 2021 survey, and again undertaken by Oxford University with partners. And the results here are from all the areas of which Oxfordshire was one, which took part. There was Oxfordshire, Buckinghamshire, Merseyside, and Berkshire. And these showed that nearly 1 in 5 students who answered the survey were experiencing mental health difficulties, and many were finding it difficult to get help. Most students were worried about how they looked, and for loneliness, around 1 in 5 students reported often feeling lonely. Over a third of year 12 students were often too worried to sleep. 1 in 12 year 9 students said they'd been bullied in the last year. And looking at some more some things around social media, 1 in 3 students spent more than 4 hours on social networking sites. And then half of sixth formers reported finding it more difficult to concentrate now than before lockdown. So that was talking about school-age children. Now I think we're also going to discuss young adults in terms of people in their early 20s. So here I just wanted to highlight some of the impacts of COVID-19 on that population. So this graph here is a graph taken from national data, and it's from a tool called the Wider Impacts of COVID on Health tool, which was available through PHE, or now OHIT. And what this graph shows is a percentage of respondents to the national survey who had a high anxiety score. That means when they were asked how anxious they felt yesterday, they scored more than 6 out of 10. And the green bars are the baseline data from 2019, and the red bars are from May of this year, so May 2021. And as you move from left to right, you're moving across age groups. So the far left here is age 16 to 24-year-olds through to 75 and older. And what I really wanted to highlight is those people who are reporting feeling most anxious and have seen the largest increase in anxiety are those who are 16 to 24 years, followed by 25 to 34-year-olds. So now I wanted to talk very briefly about the community enablers for mental wellbeing. And as I said, the ones that we've chosen to look at roughly map the enablers as part of the Concordat strategy. I've looked at 4 in particular: financial drivers and enablers, physical activity, access to and use of green spaces, and connections to others. And I'll briefly look at some results from the needs assessment on those now. So financial barriers. I'm sure everyone on the call is aware that communities report financial stress is a significant contributor to poor mental well-being. And conversely, a good job can really help mental well-being. But COVID-19 and associated lockdowns have affected different groups differently. So what I wanted to draw attention to here is this graph some people may be familiar with. It's the Oxfordshire count of unemployment claimants, and each line is a different year. And really what the standout feature is the one we're meant to notice. It's the 2020 is pink, and that shows a large increase in unemployment claimants after March 2020. And the blue line here is 2021. And although unemployment claimants are coming down, we still haven't reached pre-pandemic levels. So then I wanted to highlight a few things for our younger age groups. So between December 2019 and December 2020, the number of 16 to 24-year-olds claiming unemployment benefits in Oxfordshire more than tripled, from 950 to over 3,000. And although unemployment claims are reducing, by age group, the rate remains highest in Oxfordshire and in England for claimants aged 16 to 24. We also know that between December 2019 and December 2020, the number of young people not in education, employment or training rose from 1.6% in December 2019 to 2.6% across the county. And then lastly, the Oxford 2021 survey showed that 1 in 5 of all secondary students were worried about having enough money to pay for food or living costs. So really illustrating the impact of financial barriers on mental well-being. Also want to talk about loneliness, and loneliness here being the perceived and felt disparity between the amount of relationships and quality of relationships that you want and those that you have. And one thing that I really wanted to emphasize is this really needs to be seen as a life course and equality issue. I think it's often been portrayed as something which mainly affects older age groups, and of course it does, and is of a significant problem to those of older ages. However, we know that even before the pandemic, 1 in 10 to 15-year-olds reported feeling lonely often. There is greater loneliness at predictable transitions throughout teenage years, for example, leaving school. There's inequalities in who feels lonely, and also that national research suggests people and young people can feel embarrassed about loneliness, and it can be stigmatized. So reported loneliness has increased during the pandemic. And I wanted to highlight here, this graph here on the right is again taken from the Wider Impacts of COVID tool. And what it's showing is the percentage of respondents to a national survey who said that they often felt lonely in England. And we're looking at from beginning of April 2020 right through to September of this year across the bottom. And then the 3 lines represent different age groups. And what I really wanted to show is this red line here, the top line, so those feeling more often lonely, are those aged 16 to 34 years old. And then green is 35 to 64 years old, and blue is 65 and over. The Oxford 2021 survey, although not for Oxfordshire, but also included other areas, reported that 1 in 5 students reported feeling lonely often. And we need to understand more about lived experience of loneliness within our communities. So physical activity, I think physical activity has been discussed a lot, and the connections between activity and mental well-being are well known. And although Oxfordshire has high levels of physical activity compared to England as a whole, there are a few things I really wanted to highlight for this, for our age group of younger people. So we know that 4 in 10 children and young people across Oxfordshire are still not meeting Chief Medical Officer activity recommendations. And although Oxfordshire has been a little bit different to England as a whole in terms of effects on exercise and physical activity, in that some people have increased activity across the county during the pandemic, it hasn't affected all groups equally. So children and young people from Black backgrounds have seen the largest drop in activity levels of all ethnic groups, and those from less affluent families have seen larger drops in activity compared to wealthier families, and have also seen a reduction in feeling confident when taking part in physical activities. So lastly, in terms of the data side of things, I just wanted to illustrate really the importance of green and natural spaces and access to environmental well-being. So I think the COVID-19 pandemic has really highlighted the importance of access to green and natural spaces for mental well-being. But even before the pandemic, so in 2018, 2019, 94% of the population nationally agreed that having open green space close to home was important for well-being. We know from 10 years worth of national survey data that across Oxfordshire, most visits to natural environments are made by wealthier families and those that identify as white. And here I just wanted to show a graph which is taken from Public Health England figures, and this shows percentage of people who often visit green and natural spaces. And the green bars are adults, the red bars are children, and then you're moving from those who would be from the most deprived areas to the least deprived, and you can see that access to green and natural spaces is unequal, with more wealthy families accessing green spaces more often. So I just lastly wanted to bring those findings together in a very broad sense across the two groups of people that I've been talking about. So for young people in school and in further education, I think some of the data we have illustrates a number of problems that people are facing. So those are around poor mental well-being, especially in older years as you move through your teenage years, about the impacts of lockdown on loneliness and well-being and sleep, about younger years experiencing more bullying, and about many issues such as financial concerns affecting a wide range of people. And for young adults, I think a lot of issues around loneliness, and really the data showing that young adults, sort of all adult age groups, are more likely to self-report loneliness, the disproportionate effect of unemployment on this age group, and then obviously the inequalities which exist across all of these. So just before handing over, I just wanted to say also that the report did make a number of recommendations or themes at the end of the needs assessment, but the overarching recommendation was that given the broad number of enablers and barriers to mental well-being which exist across all of our communities, it was really about taking a systems approach to mental well-being, making use of the number of pathways and different ways to mental well-being across our communities, and having well-being in all policies, so really making it everyone's business. And then under that systems approach, there were 5 sub-themes, which included things around collecting different data, understanding more about communities and their insights, through to building inclusive services and focusing on areas of most need, and building back fairer from COVID-19. And I'll move on from there to the discussion, and with apologies for going on mute and probably taking a bit of time to get the slides back on track. Thank you.
Thank you, Kat. That was fascinating and really some compelling data and information there. And so I know Kate's posted in the box to say once the report's publicly available, we'll happily share a link to that, because I think there's quite a number of people here who will be interested to probe into the data in more detail. Without further ado, then, can I ask Susie from 180 to unmute yourself? Thank you for making the time to join us, Susie. And do you want to kick off by just introducing yourself and saying a bit about 180 and the work that you do?
Yeah, sure. So, oh, sorry, things are pinging up on my screen. I'm the co-founder and CEO of 180. 180 is a charity working across Oxfordshire, Buckinghamshire, and in the future into Berkshire. We're in our 10th year of supporting children and young people aged 4 to 18, primarily with intensive interventions across short-term work, and that's both one-to-one and group work. So primarily we focus on supporting children and young people with their mental health and well-being, but also re-engaging young people with education. So our end goal is to support young people to re-engage, not necessarily into their current school. It may be that we help them to transition to a new school or into a special school, or back into their current school after they've been off school for a number of months or years. And we do this through psychology-based interventions, which are therapeutic, they're individual, and intensive. So we have a team of up to 3 members of staff working with each individual across a 6 to 10 week intervention for up to 4 sessions a week. And that also includes working with the parents and carers. And our focus is holistically supporting that young person by assessing the young person, working with the professionals who are currently involved in supporting that young person. So that may be a social worker or a SENCO, sometimes the police are involved, and also making sure that we're involving the family and any community members that may be around them. But most importantly, meeting the young person where they are at. And that for 180 is often in a point of crisis. Not only do we work on a one-to-one basis with children and young people, but we deliver preventative mental health projects. And we've been doing that for a number of years. So one of those is a project called Make Me Smile, which is a mental health awareness project for primary school age children, where we go into year 6 classes, teach them strategies of how to support their own mental health and well-being, learn what tools they can bring home or to their peers and to themselves, and just really reduce that stigma around mental health. And then after the year 6s have experienced that session, they then teach it to the year 3. So it's this peer-to-peer learning. And then we come back into the school and we support them to host a Make Me Smile day, where all of those who've been part of the Make Me Smile session share what they've learnt and what they've implemented as their mental health whole school strategy to their parents, carers, rest of the school, and to their community. We also deliver on an annual basis our standard summer project and transitional summer project, and that involves us supporting the age range more between kind of 7 and 15 across the 2 different projects across the summer holidays, by 2 trips and some one-to-one sessions for those who may struggle to re-engage after the summer holiday period. So again, we're working with the parents and carers and the teaching staff before and after the summer project. There's a lot of things we do, but they are the main things, as well as supporting professionals with supervision based on 180's learnt and delivered internal models of supporting staff wellbeing.
Thank you, Susie. I mean, it's a huge amount that you're doing, I know. And we've heard from Kat, obviously, a lot of the data around the impacts on young people of the pandemic. What have you seen at 180 about, in terms of that impact on young people?
Yeah, I mean, just listening to Kat, it feels as though she's been spending time in our office amongst our staff team. I mean, on a daily basis, we are literally seeing all of those statistics that Kat mentioned. I think something that 180 has particularly noticed as a result of the pandemic is a rise in referrals from the primary school age range, which is really concerning, and is why over the next few years we're going to really focus on that preventative mental health project kind of area, and try and talk to the teachers about how they can support themselves in order to support the children and young people. We've just really noticed that actually some of the young people that we were working with just pre-pandemic actually really benefited from the lockdown. So these were some young people who hadn't been to school for months, and actually that lockdown suited them because they no longer had that fear of, oh, I'm being pressured to go to school. Yet actually that stress and pressure fell on the parents and carers. And as Kat identified with her statistics, you know, there is this real kind of social and economic crisis, which not only impacts the children and young people we're working with, but with those parents, carers, with the teaching staff, and everybody is acting in multiple roles, and capacity is reducing. And I think I'd say that as well is what we've noticed, that everybody's threshold is having to increase, but actually they're really struggling to maintain this supportive capacity, kind of looking after themselves as well as their own teams, or the kind of growing needs of children and young people, which is why we are really trying to expand our offer of supporting professionals.
I mean, we know that the sector is both in the statutory services for young people's mental health and in the charitable sector is just desperately under-resourced. And I think you're moving on there to talk about, you know, what the role is you can see the charity sector taking in supporting young people in the future.
Yeah, so over the number of months leading up to today, I've been in contact with a number of different organisations, and a lot of people are looking to collaborate, to partner, to share resources, to apply for some joint funding together. I know that third sector organisations, including 180 ourselves, struggle to really get the depth of the message out there as to what you do, and it's really hard to fit what you do into a 200-word count, when actually you do an awful lot and your impact is so great, but kind of communicating that concisely is really difficult. So working in partnership, working together, I think definitely strengthens the kind of impact of what you do, and also the scope of what you can deliver. And kind of touching on that, 180 has recently announced a strategic collaboration with a response organisation, which means that we are now going to be working across the 4 to 25 age range, and our aims are to impact more children, young people, young adults across Buckinghamshire, Oxfordshire, West Berkshire, really with that kind of focus on preventative mental health. If we can support more young people at a much earlier stage, then we're much more likely to impact that likelihood of them needing kind of more intensive and statutory services such as CAMS, which obviously we really want to kind of reduce that likelihood, and also we want to impact the waiting list, which is growing. I think, yeah, I would also say that kind of the third sector rallying together to communicate actually the real professional, experienced and safe processes that are in place in charity organisations. That I know a number of forums I have been on, statutory services have been concerned about, okay, is the right governance in place? Are they doing the right processes? But actually, I found that sometimes the charity sector is doing it much more thoroughly than statutory services. Obviously, that's, you know, quite a general statement to make. It's not true for all, but I know from 180's perspective that, you know, we go through things with a fine tooth comb, and we hold kind of safeguarding in as the highest priority, both for our children and young people, but also for our staff and other professionals that we work with.
Thank you. And I absolutely endorse what you say about the professionalism and quality of work in the third sector. Having been involved with OXPIP in the past, you know, they are often dealing with some of the hardest cases in the county, and because they have the skills and abilities, as do you, to deal with people in very intense and very professional ways. So thank you, Susie. Please do stick around. I can see there are questions popping up in the chat box. We'll come back to them in due course if we have time. And Laura, can I ask you Laura Hart, to unmute? Now, you have set up a new initiative around young people and mental health. Could you introduce yourself and tell us a bit about the Discovery College and why you set it up?
Yeah, very happy to. So hello everybody, nice to see some familiar faces on the webinar today and some new ones. So my name is Laura, and I am the founder and volunteer CEO of Oxfordshire Discovery College. As Adrian mentioned, we are the new kids on the block, really. So the reason that Discovery College came about was kind of twofold for me. So at the time, a number of years ago, I was running the Oxfordshire Recovery College, which is the adult equivalent of this service, and found that it was such an incredibly powerful model. And as someone who has been a youth worker for a number of years as well, it seemed like a bit of a no-brainer that this particular model would work really well with children and young people in supporting their mental health. At the same time, in 2019, we worked with a couple of young researchers to conduct a report looking at kind of national statistics around youth mental health, but also what the local picture looked like and where the stress points were in the current service provision. And there were some real gaps. This was pre-pandemic, and at the time CAMHS was seeing an 80% increase in referrals, and that was before a lot of the data that Kat just talked us through. So the strain was already huge, and we did kind of a needs analysis, and it looked like a discovery college might fit the bill. So to tell you a little bit about what a discovery college is, we don't do anything clinical, we don't do anything therapeutic, we leave that to the organisations that already do it brilliantly. Our aim is that we sit alongside all of those services and we kind of become the safety net. So we would work with young people aged 4 up to 25 and all of the adults that are around them. That might be parents, carers, grandparents, teachers, youth workers, clinicians, the whole kind of holistic circle around that child or young person. And we use education. We believe that if a young person can understand their diagnosis or understand a bit more about what's happening to them, they can develop more self-awareness of kind of what their particular triggers are or their patterns of behaviour, develop some theoretical understanding, and maybe start to build their own toolkit so that they can manage their mental health a little bit better, or support the people around them a little bit better. So that's kind of what we do. And part of the impetus for that was because we could see that as Susie and Kat have both alluded to, kind of thresholds and eligibility criteria were getting tighter and tighter in other organisations. And we were hearing from parents that they felt they were having to wait until their child became unwell enough to access services. And we felt that it should be easy to access the help you need when you need it. So what we're also seeing is that there can be a bit of a seesaw effect. So if we talk about prevention a lot, what we see is that there's a switch in service focus, that there's lots and lots of input put into very young children, which is no bad thing, but it's not that that's extra resource, it's actually that resources being taken out of adults or young adults, and therefore they get forgotten. People who are already struggling get forgotten, or that, you know, they've put some money into prevention for a while, adults are getting quite unwell and they switch the focus again. So we see this seesaw effect. So that's why we're so committed in particular to having this really broad brush approach, that we want to be a service that is for anybody, anytime.
Fantastic, thank you. And you've obviously already talked about lived experience, and I know it's really important to Discovery College and how you work. Can you tell us how you go about incorporating lived experience into the work that you do?
Absolutely, it's a complete cornerstone of our approach and we're really passionate about it. So be warned, asking this question, I could happily talk for the rest of our allotted time on lived experience and co-production. So we put lived experience right at the fore of all of our programmes, firstly. So any of the programmes that we run, whether that's on depression or self-harm or mental health in more general terms, we would have at least 2 people who have written that programme and at least 2 people who deliver it. One of them is what we call an expert by training. They might be a psychologist, a psychiatrist, a counsellor, a yoga teacher, whatever the topic is. The other person is what we call an expert by experience, and they have lived experience of having that diagnosis as a young person, or of using that tool in their recovery, or of being a parent or a carer for a young person. And that makes such a huge difference. It's not just somebody saying, this is what my textbook tells me, or this is what my research tells me will help you. It's somebody saying, yeah, I lived it, it felt like this, and now I'm kind of here talking to you and sharing my experience. And that creates lived experience role models for young people who are struggling, which is so powerful. But it also gives roots for people who are experiencing ill mental health now to move forward to something meaningful. You know, their bout of mental illness doesn't just become something really awful that they want to forget about. It becomes a meaningful experience that they can share with others and make a difference with. So that's really key for us too. But we don't just stop there, we lace it through every level of the organisation. So we have people with lived experience in kind of our management team as volunteers. Some of our trustees have lived experience, and that makes sure that we stay really relevant. We're not just kind of guessing based on the data or what we think might be most helpful. We have people who are living and breathing it every day, telling us that this is the difference that could be made.
Fantastic. And I mean, you're kind of just getting started in many ways. What do you need now and in the future to help keep up and you know, build the momentum of the work you're doing?
Yeah, it's a great question. Thank you so much for asking it. So I've got three main kind of calls to action for all of you and anyone else that watches this later and anyone that I speak to ever. So the first is something for right now. We were lucky enough to be awarded some funding to run some brand new programs, groundbreaking programs around self-harm for 4 different age groups. Damascus is going to be one of our partners in that. Nay's House is going to be one of our partners in that, and we can't wait to get them started in the new year. We are still looking for facilitators to help us run them. So if you know anybody, whether they're expert by training, expert by experience, who might want to join us in delivering some really exciting programs to young people, please send them my way. The second thing is that we really need your voices to help us to kind of spread the word. Our aim for next year is to do a significant period of growth. We'll have spent a full year piloting our model in lots of different ways, and we're looking then next year to begin rolling that out in a much more consistent way, and that's a big step up for us. So talking about us to everybody you know is going to really help us to kind of get in front of the people that need us most. And the third thing, it has to be said every time, I'm afraid, is funding. We need access to funds, not just the kind of small pots of project funding that we've been using to get us this far. They've been invaluable, but our next phase really needs us to find some core funds that are going to support us to have this step change forward and broaden our services so that we can reach more people.
Thank you so much, Laura, and thank you for all the work you're doing. I think it's really important, and I mean, part of the reason, obviously, for these webinars is to put a spotlight on huge areas of need, and you know, if we have potential to leverage funding in around a critical issue like this in the future, then I would be delighted to be playing a role in that. Kate, I know you've been monitoring the questions. What have we got?
Yeah. Well, there is a question actually following up on the funding point for Susie about how 180 is funded, and I wonder if she could talk a little bit about that, which might bring that issue to life a bit more, which I know is common to many charitable organisations.
Yeah, so we're funded through a number of different streams. So probably about 70% of our funding comes through contracts with local authorities. So we've had a number of partnerships with the special educational needs teams, with virtual schools for looked after children, and these all take time for us to really evidence our impact of supporting these children and young people, and kind of talking to them to say we can work with X number of young people over a year. And as Laura just highlighted, it takes that core funding up front so that you can not take the risk in how many staff you employ to then work with those young people, but actually kind of have that balance. The other 30% comes from applying for trust and foundation funding through kind of small community fundraising, small kind of individual donors, and then any opportunity that we have as a team to volunteer our evenings and weekends to do Christmas events or a number of other things. I know my director of fundraising and development is on the call, so I may have missed something quite key that she might kick me.
Thinking about it in the chat box. Laura, I mean, I know you're kind of resourced in large part by your time and efforts, but where have funds come in to support Discovery College so far?
A mixture, really. So we're fortunate in the nature of our project, I think, that we kind of sit in the cross section between education and health and kind of generic charity funding. So we're trying to make sure we build inroads to all of those to give us a really stable foundation. So we've accessed some of the funding through OCF and the County Council Public Health funding that was mentioned earlier. We've also been supported by a couple of smaller foundations that are interested in innovation. We've had some support from Paul Hamlin, but also there's been a bit of a surge from local schools and community groups that are holding small fundraisers on our behalf. And actually, whilst they might not be the really big substantial pots of funding, those local connections, we wouldn't trade them for anything. So those little bits of money coming from groups that we can have a personal connection with really make a difference to us too.
Fantastic, thank you. Kate.
Yeah, there are a couple of questions about the sort of relationships between charities and statutory organisations delivering services. And Susie, I know you're keen to bring in John from your partnership with Response. So I did wonder if John McLaughlin, I think he's on the line, might be able to talk a bit about that, about the kind of which services are delivered by which types of agency between charities and statutory organisations. Just going to check we have got John on the call. No, he doesn't. He's not on here. Sorry. There he is. John, you are here. I'm just going to invite you to unmute. Yeah, but perhaps we could.
Susie, do you want to
take another question whilst we wait to hear from John? There's a question about how organisations measure impact. It's obviously a complicated topic, mental health, and how do you measure the impact and how do you communicate your impact?
I'm happy to jump in here first.
Go on. It's not an easy one to answer, but
yeah.
give it a
no,
shot.
But we're really happy to be nerds about this. We get very excited about it at Discovery College because the Discovery College and Recovery College models are international ones, but they're really, really young, and that means that we have to be really committed to contributing to the evidence base. And as Susie was saying, there's something about linking in with the statutory services and making sure that they can see that we're really robust and professional in the way that we do this. We're not just some people turning up with goodwill. So we put a lot of effort into our impact measurement. So we do a range of things. We do the kind of classic feedback forms to children and to parents or to young adults, but we also use a range of wellbeing metrics that are approved by Public Health England. So for instance, we might use a kind of generic wellbeing measure, things like WEMWEB's scale, which is kind of broadly used. And then we might bolster that up with a second measure, which looks at something that's content specific. So for instance, our self-harm programme will also use a coping measure. How well do they cope with stressful situations before and after the programme, so that we can really kind of tell the distance travelled in a quantifiable way. And then alongside that, we're also really keen that there's qualitative elements, that young people are not only given the opportunity to share their views and share the difference that this has made, but to do it in a format that works for them and that they help create. So we weave it into our programme content that they decide if they're going to share their stories with us via video or a poster or a scrapbook or a letter to the funders or to us, so that they have real control and ownership, not just of what they're saying, but how they're saying it.
Fantastic. Susie.
Time from Susie, yeah.
Yeah, just very quickly to add to what Laura said, we do kind of a lot of similar things there. I also know that a lot of trusts and foundations, and obviously those that we are contracted with, so like I said, kind of the special educational needs teams, etc., they need to know that their money is going to have an impact and that it's not just going to go down the drain. So they want to know that there is that long-term sustainable change. And from 180's perspective, that's what we do in terms of we then follow up with the young people at a 2, 6 and 12 month period after we've closed our intervention. So it's not a case of just disappearing. It's a case of we've given you the tools, we've coached you, we've worked with you, we've communicated this to those that are in your current existing network, parents, carers, as Laura was kind of saying, grandparents, communities, teachers, etc. And then we follow up to check in to say, are you still using those strategies? How's that going? If it's not working, we might kind of liaise with, okay, do we need to come into a school and do some additional training around different areas? So that's kind of an additional aspect of how we monitor the impact And then we tend to use that in any of our kind of applications and evidence-based work.
Great, thank you. Now, I think we did have John, but he seems to have disappeared.
John says he's back and available potentially. John, are you there?
I'm back, yes. Apologies, I got kicked out.
I forgot what the question. It was something about the interface with statutory services.
Yeah, exactly.
John.
Yes, sorry, what was the question?
How does the charitable sector interface with statutory services, and what are the gaps and issues around that?
So I think sort of the short answer is in Oxfordshire, the statutory and third sector partnerships are very strong. And I think that we're probably much further ahead in Oxfordshire than many other areas of the country. We have a very strong history of working with the statutory sector and indeed with each other. And I think you've seen in Oxfordshire some of the most innovative partnerships in the country, and partnerships that other areas are starting to look to and take example from. And I think sort of nationally, looking at sort of most of the work that NHS England are doing and funding that they're providing going forward, they're very, very clear that funding that comes down through the new ICSs, that up to 25% of that funding should go to the third sector to help with the delivery of services. And I think there's a few reasons for that. One is they recognise that particularly in children and young people's services, there must be a very strong social element. We saw the presentation from Kat at the very start of this that emphasises that, you know, mental health is one component, but good mental health is made up of many, many other issues, most of which are social. And third sector organisations are best placed to deliver that. I think the other reason is that there is, whether people will admit it or not, there is actually a crisis within statutory services in terms of staffing. You know, you have services across the country operating with 40% vacancies. You know, and that's statutory. You know, statutory CAMS, adult mental health services, etc. So they have to engage with the third sector workforce. But even now, you know, the last year we're starting to see that actually workforce within the third sector is becoming an issue as well, which again reinforces the need for organisations to collaborate and to share resources and staffing where at all possible, so that we can make the most efficient use of it. But yeah, nationally, very, very strong, very, very strong indication to work with the third sector.
Excellent, thank you, John. And I think we all know, or we'll all have heard stories about how hard it is to access services and support for young people with mental health problems in Oxfordshire and nationally, and that is just a consequence of the lack of resources going into the sector, both in terms of statutory services and in terms of the charity sector. Kate, do we want to squeeze one more in?
Yeah, there's one more question. I think possibly it's a question for Kat. From Joe Broad, do we have a sense yet of what has been the impact of the CYPMH Green Paper funding, which came into Oxfordshire, on things like waiting times and prevalence rates of mental illness amongst young people?
So I'm going to answer that. I'm afraid that that's probably outside of the area that I was looking at, because mine was particularly on mental well-being rather than on service use. I do have a colleague, Jack Gooding, online. I don't know if he's got any further insights on that. So I'll just pause and see if Jack knows anything about that.
You there? Do you want to unmute yourself and come in?
Yeah, again, I think that's probably outside of public health's jurisdiction. But if you want to put that in an email, we'll try and find out the answer from colleagues in the system.
That would be great. Thank you. Right, I think we'll draw a line there. It's been a fascinating, if slightly concerning session for speaking as someone who has teenage children and many friends with teenage children. But I think we can all be heartened by the incredible work that's going on in organisations like 180 and Discovery College. So we will be wrapping up there, saying thank you to our speakers, to Kat from Public Health 180, and to Laura from Discovery College. We're going to be back on the 15th of December at 2 o'clock for a general networking session, probably with a glass of wine and a mince pie if you fancy it. And then we're going to be shifting to quarterly webinars in 2022. We think they're really important. We think they work well, even in a world that we hope will be increasingly in person. But do let us have any feedback or thoughts about how you would like to see them structured in the future. We'd love to hear from you. And the final thing I want to say is that, you know, my mantra personally, as someone who's done a lot of work on thinking about mental health, both for myself and for broader society, there's a huge amount of evidence that says, you know, eat well, get some exercise and sleep well. If you can manage that triumvirate, you're probably halfway there in terms of mental health. Thank you all so much for turning out again. And as ever, do get in touch. My calendar link is in the chat box. Always happy to have a chat with people. And in the meantime, I hope you have a very good month and the run up to Christmas is calm and peaceful for you. Thank you.